communications major here, and I'm going to do my presentation on diabetes. 25.8 million children and adults in the United States, which is 8.3% of the population, have diabetes. I'm going to show you a little video on what diabetes kind of
Diabetes is a common condition that affects all kinds of people all over the world. It prevents your body from making enough insulin and using it properly. What's insulin? Well, insulin is a hormone your body needs to change food into energy. This is very important because your body needs energy to work well. Your body is made up of many different organs, and they do many different things. One of these organs is called the pancreas, which is where your body makes insulin. When you eat something, your digestive system breaks the food down so it can move through your blood and into your cells. Carbohydrates, or starches, are broken down into glucose, a type of sugar. Your cells use glucose as fuel. Insulin moves glucose out of your blood and into your cells. That's so your body can create enough energy to get you through the day.
So we're going to learn what is diabetes, types of diabetes, the causes and symptoms, and treatments. What is diabetes? Diabetes is a condition in which the pancreas no longer produces insulin, or when the cells stop responding to the insulin that the pancreas produces. Type of diabetes. There are 3 types of diabetes. The first type is type 1, which is sometimes referred to as juvenile diabetes, which is most common in childhood and adolescence. In this form of diabetes, the pancreas stops producing insulin or just doesn't produce enough, and it's characterized by a sudden onset. In this form of diabetes, the patients need to inject insulin in them daily. Another type is type 2, which is a group of disorders caused by some combination of insulin resistance. Type 2 has been called adult onset diabetes because most people with type 2 diabetes are adults. It was also called non-insulin dependent diabetes because people with type 2 usually do not require insulin injections. The third type of diabetes is called gestational diabetes. It developed during pregnancy, during usually the second or third trimester, and evolves after the baby is delivered. This diabetic condition develops, like I said, in the second or third trimester, and in about 2% of pregnancies. These women who have diabetes during the pregnancies are at higher risk of developing type 2 diabetes within 5 or 10 years. Causes and symptoms. There's no real cause of diabetes, but they're both hereditary and environmental factors. And research has shown that some people who develop diabetes have common genetic markers. In type 1 diabetes, the immune system is believed to be triggered by a virus or another microorganism to destroy the cells in the pancreas that produce insulin. In type 2 diabetes, age, obesity, and family history are affect many. Symptoms of diabetes can develop suddenly in previous healthy children or adolescents, and can develop gradually in overweight adults over age of 40. I know my little cousin, she was so healthy and she just developed it a few years ago. The classic symptoms are including feeling tired and sick, frequent urination, excessive thirst, excessive hunger, and weight loss. Treatments. There's currently no cure for diabetes. The condition, however, can be managed by patients so that they could live normally. There's 2 goals of treatments: keeping blood glucose within normal range and preventing the development of long-term complications. careful monitoring of diet, exercise, and blood glucose levels are important, as the use of insulin oral medications in preventing complications of diabetes. Diet and moderate exercise are the first treatments. Oral medications are available to lower blood glucose, and patients with type 1 need daily injections of insulin. The amount and type of insulin required depends on the height, weight, age, food intake, and activity level of individual diabetic. Some patients with type 2 diabetes may not use insulin injections if their diabetes cannot be controlled with diet, exercise, or oral medication. Conclusion, there are 3 types of diabetes: type 1, type 2, and gestational. The cause of diabetes is unclear and are believed to be brought on by hereditary and environmental factors, also weight and age. And the classic symptoms are feeling tired, sick, hungry, urination, and thirst, and weight loss. And treatments: exercise and dieting, oral medications, and insulin injections. Does anyone have any questions? Meghan Rice.